to go and talk about heart failure. So, heart failure is the condition where the heart is unable to pump blood effectively in order to meet the body's metabolic needs. We have several. If there is reduced blood flow to the heart, it will lead to heart failure because the body will not be meeting its normal metabolic needs. Yeah. So we have several causes of heart failure. Several causes of heart failure. What causes heart failure? Now that heart failure is due to reduced blood flow to the heart, or due to the heart pumping the blood effectively in order to meet the body's metabolic needs. What are some of these causes? One, we have hypertension. Hypertension is the high blood pressure. In other words, it's the high blood pressure. The normal blood pressure inakwanga systolic all over diastolic. Systolic is the contraction of the heart muscles. Diastolic is the relaxation of the heart muscles. So whenever the heart muscle contract, the pressure inafanga kuwa the normal one kwa diastolic inafanga kuwa 100 to 120 milligram per mercury. So that is the normal one, 100 to 120. So ikiwa in relaxed state inafanga kuwa 60 to 80. 60 to 80. Yeah, so the normal one person mwenye ako na normal inaweza kuwa 100, 110, 119 all over 69, 79, 80. It's normal. Yeah, so in case there is increased blood pressure, or the high blood pressure, elevated high blood pressure, it will lead to heart failure. Yeah, because the vessels will constrict. So whenever the vessels will constrict, it will lead to increased blood volume. When there is increased blood volume, it will come to an extent where even the blood vessels themselves they burst. Yeah. So that is one. That is high blood pressure. So the other one is about diabetes. Diabetes also is a major cause of heart failure. Say why? Because whenever there is diabetes itself is the elevated blood sugars in the level in the body. Well, whenever you have elevated blood sugar in the body, it will lead to heart failure. How does it lead to heart failure? It leads to heart failure because when there is high glucose levels or sugar levels in the blood, it will lead to constriction of the muscles or the constriction of the vessels. So whenever the vessels constrict, it will lead to high blood pressure. Whenever the blood pressure increased, that is hypertension. Automatically, we have said hypertension is the major cause of heart failure. It will automatically lead to heart failure. The other cause is about excessive alcohol consumption. So kwa wale wasio wenye wanakunywa pombe sana, you should limit because you are at high risk of getting heart failure. Because whenever you consume alcohol too much, isn't it? It has increased risks because it will first damage the liver. After damaging the liver, it will also go and damage the kidney. Yeah, all sort of those things. It will damage the major organs of the body, leading to heart failure. So the other cause is about coronary artery disease. As you know, coronary artery disease, coronary artery ni hiyo vessels yenye inachukua damu kwa heart, ina supply damu to the heart. That is coronary artery. So whenever you have an infection in the coronary artery, or maybe because the coronary artery has clogged, maybe because of fats, that is atherosclerosis, maybe because of anything else, actually it will lead to reduced blood supply. When there is reduced blood supply, it will lead to heart failure because the heart will be unable to pump blood effectively. leading to heart failure. The other thing is about genetics, genetic factors. So this is about gene mutation. Yeah, in case there was a case concerning a certain gene in your family, maybe a family history, a person had heart failure. Yeah, the genes might transfer. Yeah, that is also the other cause. Yeah, there are so many causes. There are so many causes of heart failure. These are just some of the causes. And the other thing is about lifestyle, lifestyle modification. Lifestyle modification is about the things that we eat, isn't it? The things that we eat, the food, the sugary foods, the fatty food meals. Those we should avoid because they are at high risk of causing this kind of a condition, which is called heart failure. So the the how will you manage now that we have that condition? How will you manage or treat the condition, heart failure? The first thing is pharmacological therapy. Pharmacological therapy is there are those drugs, many kind of drugs that we are given in order to do what? To manage or treat the heart failure. So we have several drugs that are going to be used. We have beta blockers. Beta blockers, as the name suggests, beta blockers. They block the beta receptors. In the heart, we have receptors. We have both alpha and beta receptors. We have beta 1 receptors, beta 2 receptors, and beta 3, which is in adipose tissue. And we have alpha 1, we have alpha 2. So beta 1 is commonly found in the heart. So these drugs will go and work on beta 1 receptors by blocking beta 1 receptors. Whenever they block the beta 1 receptors, they will, whenever they block the Ziki block E receptors, they will reduce sympathetic activity. That is the actions of adrenaline and noradrenaline. So, whenever they block that, they will increase contractility of the heart muscles. Whenever there is increased contractility of the heart muscles, it will lead to increased blood volume, which will enable the heart to pump blood effectively to meet the body's metabolic needs. And the blood now is being supplied to various tissues, the tissues, and major organs of the body, and that one will be management. The other thing is about there and examples of those beta blockers. We have atenolol, we have propranolol, we have there are so many, labetalol, carvedilol. Yeah, there are so many. So the other things is about digoxin. Digoxin is a glycoside. A glycoside is an inotrope. So it will also work by this because digoxin yenyewe inakuanga na low therapeutic dose, so it should not haifangi kupeanwa in overdose because it is of high risk. So that is digoxin is the major drug yenye natumianga wakati wa nini, emergency heart failure. In case a person has emergency heart failure, digoxin is usually injected. Yeah, is usually injected parenterally. So it also works by increasing the contractility of the heart muscles because it has the positive inotrope, that is the contractility. Yeah, contractility. It also, yeah, it after increasing the contractility, it will lead to what? It will help to manage and treat the heart failure because it will enable it to be it will enable enough efficient blood supply. So let's meet next as we talk about what causes, what are the causes, what are the how can we manage non-pharmacologically. Thank you so much.